Variations in pediatric medication administration techniques are determined by factors such as the child's age, weight, the type of medication, the route, and individual preferences. Factors that have an impact on the effectiveness of medications include differences in absorption, metabolism, distribution, and excretion. The most common route for medications given to children is by mouth. Children under 5 years will probably have a hard time with pills or capsules, so they need a chewable or liquid form. An oral syringe is a good way to deliver small amounts of liquid medications accurately to infants and small children. For an infant, give the medication using the syringe, or place it in a nipple and elicit the suck reflex. While crushed medications can be given mixed with a small amount of applesauce, pudding, or ice cream, this should be avoided if at all possible, so that the child will not connect nutritious foods with medicine. Don't refer to chewable medications as candy. The child may later confuse the medication with actual candy and inadvertently take the medication. To administer eye drops, place the child in a supine or sitting position with the head tilted back and the child looking up. While you retract the lower eyelid, instill the drops into the lower conjunctival sac. For eye ointments, cleanse the area, then apply about half an inch of the ointment along the lower conjunctival sac from the inner to the outer canthus. Have the child close the eye and move it from side to side to distribute the medication. Ear drops should be at room temperature before giving them. For children up to about 3 years old, pull the ear down and back to straighten the ear canal. For older children, tug up and back. Administer nose drops with an infant or child lying flat and with the head in a sniff position. You can do this by positioning the head over the edge of a pillow. Keep the child in that position for about a minute so that the drops can penetrate the nasal cavity. Intramuscular injections are invasive, painful, and traumatic, and should be avoided if at all possible. When IM medications must be given, the preferred site for children under 3 years is the vastus lateralis muscle. This is a large and active muscle that has few major nerves and blood vessels. Actually, the vastus lateralis is a safe and effective site for an injection at any age. For older children, you may also use the ventrogluteal site, although some sources consider the dorsogluteal site unsafe. It should certainly be avoided for children under 6 years of age and never used for any child who has been walking for less than 2 years. The deltoid may be appropriate for older school-aged children or adolescents who have developed adequate muscle mass and muscle tone.